regarding the scapula and its osteology related points regarding the different external features of scapula, and we have discussed a few points regarding it in the previous session. So now we will have a quick revision or a recap into the muscle attachments on the scapula bone. It is almost connected to the external features that we have studied in the previous session. So it's a continuation, and you can listen to me, and if you have any doubts regarding the muscular attachments, or if you want to explain something in detail, you can always put your queries on the comment box. So let's begin with the muscular attachments of scapula bone. A quick recap into the external features. We had three angles, then we had three processes, we had two surfaces, the costal surface and the dorsal surface. So we will see them one by one. We'll begin with the first one, that is the costal surface. So here you can see it is a concave surface which is coming in close contact with that of the costal surface, or like to the rib cage. And this area, the subscapular fossa over here, is actually the attachment point of a muscle named as subscapularis muscle. And you can see the medial border, which is the thin border, and the medial border and its costal surface gives attachment for the muscle named as the serratus anterior. So these are the two major attachments that will come in the costal surface. The central area, the subscapular fossa, will be giving attachment for subscapularis, and the margin, the medial margin of the costal surface will be giving attachment for the serratus anterior. Now let's move to the dorsal aspect. I've told you there is a spinous process. The spinous process divides the entire dorsal surface into an upper part, that is the supraspinous fossa, and a lower part, that is the infraspinous fossa. So these two fossae are actually the muscular attachment points. So here the supraspinous fossa gives origin for a particular muscle called as the supraspinatus, while the infraspinous fossa gives origin for the infraspinatus muscle. So it's easy to remember also. So the upper one, the supraspinous fossa, giving origin for supraspinatus, while the lower one, which is the infraspinous fossa, will give origin for the infraspinatus muscle. So these are the two on the dorsal aspect. Apart from these fossae, we have the lateral border here, and behind the lateral border on the dorsal surface, you can see clearly some bony landmarks. So this area, what I'm exactly touching right now, this is the attachment point for the teres minor muscle, and below it is the teres major. So the upper part of dorsal aspect, especially on the lateral, along the lateral border, here you can see the upper part, upper 2/3, is actually giving origin for the teres minor muscle, while the lower 1/3 here gives origin for the teres major muscle. And the tip of the inferior angle is giving origin for the muscle named as latissimus dorsi. So the latissimus dorsi is a very broad muscle which is having multiple origins. One origin is from the scapula, and particularly from the inferior angle. So let's have a quick recap. The supraspinous fossa will be giving origin for supraspinatus. The infraspinous fossa will be giving origin for infraspinatus, and the lateral border along the dorsal aspect, the upper 2/3, gives origin for the teres minor muscle origins which are arising from the dorsal aspect. Now we have to look closely to the crest of the spine. So the crest of the spine is having an upper lip and a lower lip, as you can see here. So if you have a observation from the lateral angle here, you can see there is an upper lip and a lower lip. So these two lips are giving origin and insertion for certain muscles. The upper one is actually the shoulder muscle, the trapezius, will be getting inserted along the upper lip of crest of the spine, and the lower lip is particularly giving origin for a certain group of fibers that is known as the posterior fibers of deltoid muscle. So I can show you just a demonstration. So this is how anatomically it will be placed in your body behind, and I'm holding the right scapula here. So from the lower lip of crest of the spine, there will be a set of fibers arising, and it forms the deltoid muscle here. So on the lateral aspect, you can clearly see the deltoid muscle, which will be posterior fibers will be originating from the lower lip of crest of the spine, and the upper lip will be giving insertion for the trapezius muscle that will be getting inserted there, which helps in the elevation of scapula. So we have learned 1, 2, 3, 4, 5 and 6 attachments here, and also the origin point of the posterior fibers of the deltoid. And apart from these attachments, we have to look closer onto the other processes that we have. We have the acromion process, we have the spinous process, and we have the coracoid process. So when we consider the coracoid process, it gives origin for multiple muscle fibers. The first one, the tip of the coracoid process, gives origin for a muscle that is part of the upper limb, especially the arm, the coracobrachialis. The name itself suggests that it arises from the coracoid process and gets inserted on the arm. That is why it has got the name coracobrachialis. Coraco refers to, it starts from the coracoid process, and the brachium refers to the arm. So coracobrachialis arises from the tip of the coracoid process. Then apart from that particular muscle, we also have the biceps brachii, especially the short head of biceps brachii is arising from the tip of the coracoid process. So we have two muscles now originating from the coracoid process. The first one, the coracobrachialis. The second one, that is the biceps brachii, especially the short head of biceps brachii. And there are certain ligaments also arising from here. So we are not mentioning about the ligaments right now. I'll just say about the muscle attachments. So I repeat, two muscles from here. Then we have the glenoid cavity here. So along the margin of the glenoid cavity, it is oval in shape, and this margin of glenoid cavity gives attachment for a ligament that is called as the glenoidal labrum. So the glenoidal labrum will be attached along this margin to make this particular glenoid cavity a little more deeper, so that it can clearly fix in the head of the humerus without much difficulties. Otherwise, it is a highly unstable joint. So without that particular rim formed by the glenoidal labrum, the head of the humerus can easily slip off. To prevent that from happening, there is a support system. One such support system is the glenoidal labrum. And along with that, we have two prominences above and below the glenoid cavity. The one above it is called as supraglenoid tubercle, and the one below it is the infraglenoid tubercle. These two tubercles are giving attachment for certain muscles. From here, the supraglenoid tubercle, it is the origin point of the long head of biceps brachii. The short head was arising from the coracoid process, while the long head of biceps brachii is arising from the supraglenoid tubercle. While the infraglenoid tubercle that you can see here, this is the origin point of the long head of triceps brachii. So these are the muscle attachments in this process region. So from the coracoid process, we had the short head of biceps brachii, coracobrachialis. Then from the supraglenoid tubercle, we had the long head of biceps brachii, and from the infraglenoid tubercle, we had the long head of triceps brachii. So these were the major muscle attachments, and along with this, you have to consider the acromion process. So the acromion process, as you can see here, it is a flattened structure with different margins. So when I'm holding it in this particular angle, you will get a superior view of the acromion process here. So we have the crest of the spine, upper lip, continuing as the medial border of the acromion process. Then the lower lip of crest of the spine continuing as the lateral margin of the acromion process. And I've told you already that the lower lip of crest of the spine is giving origin for the posterior fibers of deltoid. At the same time, the middle fibers of deltoid are arising from the lateral margin of the acromion process. So that is an additional origin point that I have to mention. The deltoid muscle have 3 points of origin: the posterior fibers, middle fibers, and the anterior fibers from the clavicle. So these are the major muscle attachments you have to know regarding the scapula. So we will have a quick revision of all the muscle attachments once again. So we will begin with the costal surface. In the central part, we have the subscapularis, and along the medial margin of the costal surface, we have the serratus anterior attached. Then on the dorsal aspect, we have the supraspinatus originating from the supraspinous fossa, infraspinatus arising from the infraspinous fossa. Then along the lateral margin on the dorsal surface, the upper 2/3 gives origin for teres minor, the lower 1/3 gives origin for teres major. The inferior angle of scapula gives origin for latissimus dorsi, and on the crest of the spine, on the upper lip, we have the insertion point of the trapezius muscle. On the lower lip, we have the origin point of the posterior fibers of deltoid muscle. And on the lateral margin of acromion process, we have the origin point of the middle fibers of deltoid muscle. Then we have the next process, that is the coracoid process. From the tip of the coracoid process, 2 muscles. One is the coracobrachialis. The second one is the biceps brachii, especially the short head. And while the long head is arising from the supraglenoid tubercle, the long head of triceps brachii arising from the infraglenoid tubercle, and the margin of glenoid cavity gives attachment for the glenoidal labrum, making the shoulder joint much more stable. So these are the muscle attachments that you have to know regarding the scapula. So if you have any doubts regarding the same, you may post it as the comments, and we will address the queries pretty soon. Thank you everyone for watching.